Welcome to today's important hearing examining the structural challenges facing the federal government's major health and retirement security programs. This is a hearing we have every year, and unfortunately it's a hearing where the news just gets worse. We welcome back to the committee the two foremost experts on the financial crunch facing Medicare and Social Security, the chief actuaries of each of the two programs. Rick Foster, the chief actuary of the Center for Medicare and Medicaid Services. Rick's nonpartisan analysis is second to none in illuminating the challenges in healthcare and the consequences of trying to squeeze savings from the rather blunt instrument of price controls. We also welcome Stephen Goss. We've known Steve a long time. He's the chief actuary at the Social Security Administration. Stephen's analysis should be required reading for policymakers, and we thank you for taking the time out of your busy schedule again to unpack the facts and to share your insights with us today. For too long, politicians in Washington have not been honest with the American people, and seniors in particular, about Medicare and Social Security. Instead of engaging in an honest debate about the path forward to strengthen these programs, too many have offered little more than false political attacks and trillions of dollars in empty promises. Today's hearing is an effort to honestly assess the challenges facing these two critical programs, providing the clarity to Congress as we work to advance sensible reforms and to ensure that these critical 20th century programs can fulfill their important mission into the 21st century. There's a very clear choice of two futures for both programs. For Medicare, we can follow the path set by the President's health care law and the additional Medicare cuts called for in his most recent budget request. On this path, Medicare is rated to the tune of about $500 billion to fund a new open-ended entitlement, and the fate of seniors' care is left in the hands of 15 unelected, unaccountable bureaucrats in Washington. These bureaucrats are empowered to cut Medicare in ways that will result in restricted access and denied care for current seniors. Meanwhile, this path leaves Medicare bankrupt for future generations. Or we can chart a brighter future for Medicare. There is a growing bipartisan consensus for reforms that ensure no disruptions for those in or near retirement, while offering the next generation a patient-centered Medicare program that offers more choices and more security. For Social Security, we can follow the path set by President Obama's most recent budget request. Failing to meet the test for leadership that he himself established, the President has hedged and dodged, but has yet to advance credible solutions to shore up Social Security's fiscal imbalance. As the trustees have warned, the President's unserious approach to Social Security will result in serious consequences for seniors. An across-the-board 23% benefit cut when the trust fund is exhausted, which is scheduled to hit when those entering the system today are in the heart of their retirement. Or we can chart a brighter future for Social Security. Similar to Medicare, I believe that there is a growing bipartisan consensus for sensible, gradual reforms that ensure no disruption for those in and near retirement, or offering the next generation a program that reflects demographic reality, a more progressive benefit structure, and a solvent future. I thank my colleagues here at the Budget Committee for engaging in this spirited debate with mutual respect for one another and a shared commitment to make good on the promises of these critical programs. The decisions we make in the next few years will amplify throughout the century and will affect every single human being we represent. We look forward to the testimony of our two esteemed witnesses, but before I do, I'd like to yield to the ranking member, Mr. Van Hollen, for his opening statement.